everybody. Glad you're all on the call today. I hope the weather is as pretty where you are as it is here today because it is absolutely gorgeous down here in South Georgia. Um, as as um, as you know, I'm a regional coordinator, and right now we have one other regional coordinator. Her name is Stephanie Flowers. She's on the call with us today, and you might have already met her, but if you hadn't, we look forward to getting together with everybody and meeting everybody and seeing everybody again real soon. Stephanie first started with access to services, and then she came over to business ops to work with us. So we're glad to have her. Um, so of course let's see if I can get my PowerPoint to work. Um, okay, we'll just move on down to regional coordinators. The RCs serve as the liaisons by providing information and support to assist the Georgia Department of Human Services Division of Aging Services, DAS, the area agencies on aging, and their service providers in making valid decisions regarding programs, services, and policies. We report directly to the DAS Senior Business Operations Manager, and that's Blake Lanier. And we strongly advocate that quality assurance is a collaborative effort team by all partners. You start, with DAS staff, with the area agencies on aging, and then the AAA's providers. In order to provide technical assistance to the AAA's, the regional coordinators are familiar with AAA administration, contract terms, programmatic and financial policies and requirements, the WellSky data system, area plans and the reports. We consult with the DAS and AAA staffs to evaluate policies and process. We're always looking to make things better. We facilitate communications between the Division of Aging Services and the AAA's. We assist with requests from the AAA's to the DAS, and then, of course, any requests from the DAS to the AAA's. We try to stay in real, close communications as we consult with the appropriate DAS staff for clarifications and responses to the AAA's. We review budget revisions in WellSky and coordinate with the DAS contracts administrators and give our comments on those. And we organize, schedule, and facilitate the AAA's mid-year reviews. We participate in the DAS AAA meetings, trainings as this, and the other DAS program meetings. We also participate in report development and the report review meetings with the DAS section staffs. These are reports that either DAS section staff ask for or either the AAA's may ask for. But there again, we all work with the program integrity sections report developers. We work with the DAS help desk staff to assist in resolving help desk issues, anything varying from such as report issues, area plan, reimbursement, or invalidation issues, and then we provide technical assistance to DAS and the AAA staff. We coordinate with DAS staff on developing, like right now, some of you may have heard, we're working to develop a WellSky data entry refresher training. And we're also working to update the DAS taxonomy of services document for its content, and we need that continuity as in WellSky. So we also schedule and facilitate the weekly WellSky calls on Thursdays. We receive the AAA's annual data, such as programmatic logs and consumer satisfaction reports. We assist in drafting or reviewing the DAS policies, correspondence, and communications. And there again, when we get those waiver requests from the AAA's, we convene a DAS waiver review team meeting and to review the waiver requests. And then generally, we draft the request response for the review team's review for any changes or approvals. So once the waiver response is signed by the DAS division director, we provide that back to the AAA's, And then again, we maintain the documentation of the request and the approvals or the non-approvals. Another thing that we're strongly involved in is the AAA area plan development, their submissions, and the approval process. As required in the Older Americans Act, Section 306 and DAS Otis Policy 3021, and of course, based on the uniform format provided by us for the AAA's area plans, annually, each AAA prepares its initial area plan to begin the designated 4-year area plan cycle, and then the AAA's prepare annual area plan update for each following year within the cycle. As Eddie was talking about the area plan and the state plan, I'm sorry, our AAA area plans have the same focus as the state plan. Preference will be given to the provision of services to older individuals with the greatest economic or social need, with particular attention to low-income minority individuals, individuals at risk for nursing home placement, older individuals living alone, and older individuals living in rural areas. The AAA area plan format, our new cycle started for SFY 2021 and goes through SFY 2024. It was, as Eddie talked about before, it was coordinated with Georgia's State Plan on Aging for federal fiscal year 2020 through 2023. 26 of the state plan goals and objective measures were included in the AAA's area plan template. And once the AAA's got those, then it was their responsibility to develop their own strategies to accomplish the measures for each objective. To begin with, when we start the area plan cycle, though, we work with DAS staff to prepare the initial area plan template and area plan instructions document. Then the document is provided to the DAS management team for any reviews or changes in their approval. And then, of course, we prepared the AAA area plan update instructions documents to include any additions or changes from the initial or previous year of the cycle, and the area plan, and we also prepared the area plan review documents for DAS program staff and the fiscal staff. Included in the area plans, these are just a list of some of the things that are in there. There's always a detailed checklist which lists all items included in the AAA's area plan. We have several signatory documents, the letter of intent, the agency indirect allocation cost plan, the board resolution, waiver requests, and standard assurances. Included in the executive summary for each AAA's area plan, that's where it explains the aging network from the federal level down through their provider network, and the AAA's vision, mission, and values. And we have to keep in mind that AAA's area plans, they're public documents. So that's the reason why they go into so much detail in describing their area, to include the regional context, which describes the region, the population, the ages, caregivers, needs assessments, report results of the public hearings, and any special needs in the region. We had let's see, 4 different tables added for the SFY 2022 area plan updates. And these all happen in item 5 in the area plan. And it had to do with the services and descriptions of multi-funded services contracts and discretionary grants. So table number 5A1 is where all the services, the AAA enters their services and the descriptions of the services that are provided through the DAS multi-funded services contract. And in this table, the AAAs were asked to provide if the AAA provides the service or if the service is through a contract. So then for the services that are provided directly by the AAA, those follow into table 5A2, and that's where the AAA describes those services and gets a little in more detail as to how it's done. Then, of course, Table 5A3 is for case management services that are provided in the region. And 5B is for AAA services provided through discretionary grants. For all of these tables, the AAAs are asked to respond to varying questions relative to each grouping for maintaining compliance with the Older Americans Act and, of course, for audit compliance rules. Let's see, so some other things that are in the AAA's area plan are narratives for allocation, their methodology for allocating the funds, budgeting, and changes to any service units and persons that were from the previous year. And of course, we have our goals and objectives and our measure charts. Then we have our fidelity assurance bond coverage. There is a report in WellSky that the AAA's run. It's called the Area Plan Provider Services List, and they include it so that we can see the providers that they're working with. And then, of course, this year, everything is all due to the COVID. We asked them to add their last little section to the area plan on how the pandemic had affected the AAA. So how the review process starts, we provide the other side of the DAS review process for the area plans. We receive the AAA area plans via WellSky. We review AAA WellSky planning budgets and the reports, and we coordinate those findings with the contracts administrators. Then we also review the area plans, and we coordinate and combine our comments with the DAS staff review comments. Then we provide the DAS staff review form to the AAAs as notification as it could be approved, or there could be requests for additions or changes to the AAA's area plan. There again, we receive the area plans again from the AAAs, and of course the review process at the DAS level begins again. And of course the process gets repeated until approval is reached for all 12 AAAs. Are there any, I can't see the chat box. Are there any comments or questions?
Not yet.
Okay. Okay. Well, we're always around. We're always reachable by email or telephone. So if anybody has any questions, do not hesitate to let Stephanie and myself know. And we just want you all to know that it is truly our pleasure to work with all of you. So thank y'all. We appreciate you listening in today.